Speaking of peaceful and calm,
Yes.
we're going to talk about the peaceful and calm hormone, which
Oh, cool.
not a lot of people know about. You know, the steroid hormones that are all derived from that demonized and vilified molecule cholesterol, are involved in a whole slew of functions that involve coping, involve dealing, growth,
Okay.
repair, and anti-aging, and immunity, and inflammation. And unfortunately, the steroid hormone that has the most calming effects, most relaxing effects on the body, is the one very few people know about. So all of the steroid hormones derive from cholesterol. Cholesterol is the master molecule, and in a way, the steroid hormones are actually all derivatives of cholesterol. They're also, you can even think of them as types of cholesterol. And the reason I say that is because it really underscores and highlights the importance of cholesterol. We can talk about the importance of cholesterol on another video, but for now, I want to stress that the steroid hormones all come from cholesterol, and they're made in a sort of cascade or a stream, if you will, a flow, where it all starts with cholesterol. You can put that first slide up.
Certainly.
Cholesterol is then turned into pregnenolone. Pregnenolone is a wonderful calming hormone, and then pregnenolone gets turned into progesterone, which is the hormone we're going to talk about here in a moment. Both pregnenolone and progesterone have calming effects on the body, and both pregnenolone and progesterone are available over the counter as a reflection of their relative non-toxicity. As you go down the flow chart, you get more and more toxicity. So after progesterone, you go into the male hormones, which are called androgens, which are exemplified by testosterone. Of course, testosterone requires a prescription. In fact, testosterone is actually a scheduled drug due to its toxicity. And then finally, you get the most toxic of the steroid hormones, or the cholesterol derived hormones, which are estrogens. So today I want to talk about progesterone, which I feel is super under leveraged and underappreciated, both medically and by end users. Next slide.
Outstanding. Before we go on, we've got just a quick hello from Patty. So
Hey,
before,
Patty.
hey Patty, thank you so much for your shout out. We really appreciate all the questions and comments. Don't be afraid, people out there. All right, Ben, it's all
Yes,
yours.
appreciate you, Patty. Thank you. So put the
Next
next slide up.
slide. Next
Yeah,
slide.
I first started to understand progesterone when I started to read Dr. John Lee, who is well known back in the 1990s as a real advocate for progesterone. He wrote a book called What Your Doctor May Not Tell You About Menopause. And then he wrote a couple other books, what your doctor may not tell you about perimenopause, and what your doctor may not tell you about breast cancer. And he was the first guy that really turned me on to the importance of progesterone. And in his book, What Your Doctor May Not Tell You About Menopause, he has a comparison chart between estrogen, which everybody knows about, and progesterone, which a lot of people don't know about. And when you look at them side by side, the relationship or the comparison between these two hormones, you wonder, why is it that we're all talking about estrogen, at least from a pharmacy and a medical standpoint, and not progesterone? Put that next slide up, that comparison chart there, Liam. So when you pull it, no, not that one, the one where we compare physiological effects. No, not that one, the next one. The one, there you go. Can you pull that up? Is that possible to pull up, Liam? There you go. So you can see here, estrogen effects creates the endometrium, it stimulates breast cells. It's associated with fibrocystic breasts and also associated with breast cancer, increases body fat, salt and fluid retention are associated with estrogen, depression, anxiety, headaches, migraines, poor sleep, loss of zinc, which is a very, very important hormone for the immune system and for anti-aging and for brain health and for bone health, for skin health. Reduced oxygen levels, it's associated with endometrial cancer, breast cancer, prostate cancer, bone loss. It's associated with autoimmune diseases. Estrogen also is associated with gallbladder issues. It's got a whole slew of health challenges that are linked to it. It does relieve hot flashes and night sweats. But when you compare it to progesterone, pull it down a little bit, you can see progesterone is protective against cancer, prevents breast cancer, pull it down a little bit, buddy. Just a little bit more. Just one more down. No. Go. I want to see the top of the page. There you go, right there. So it helps the body use fat. It's a fat burner. Estrogen causes you to gain weight and gain fat. It's a natural diuretic. It's a natural antidepressant. It calms you down. It promotes sleep. It facilitates thyroid function. It normalizes blood clotting. Estrogen's a blood clotting agent. You can see all these wonderful benefits associated with progesterone as opposed to estrogen, which is impairs your blood sugar, causes you to gain weight, causes anxiety, night sweats. To me, it's like crazy why we're all obsessed, at least from a medical standpoint, with estrogen when progesterone has all of these wonderful benefits, and progesterone also helps your estrogen work. Progesterone upregulates receptors for estrogen so that you actually get estrogen benefits when you use progesterone, and you don't have to deal with any of the toxicity associated with estrogen. Next slide, buddy. Some of the symptoms that are, if you pull that up a little bit, some of the symptoms that are associated with low progesterone include hot flashes, migraines, depression, mood changes, sore breasts, tender breasts, vaginal dryness, problems with your blood sugar. These are all associated with low progesterone levels. Progesterone levels drop much more dramatically than estrogen levels. You're always making a little bit of estrogen, even until the day you die, you're going to make estrogen, because estrogen is made in fat cells, unlike progesterone, which is made basically in the gonads and in the adrenal gland. Progesterone levels drop much more precipitously and dramatically than estrogen levels do. So you're always making a little bit of estrogen, but as we age, we make much less. In fact, our progesterone levels can drop down to near zero. So for all of these reasons, it makes much more sense to use progesterone supplementally than it does to try to dose yourself with pharmacological estrogen. Estrogen does require prescription. Progesterone is, as we mentioned earlier, over the counter. Some of the causes of low progesterone include low levels of cholesterol. If you're on a statin drug, you run the risk of lower levels of progesterone. Hypothyroidism is one of the most important causes of low levels of progesterone. And of course, menopause and aging will also decrease progesterone. Progesterone effects and secretion can also be caused by high cortisol or high stress hormone. And it turns out that progesterone can actually help relax or lower cortisol levels. So there's this antagonistic relationship between the two. Next slide. One of my favorite benefits for progesterone is in terms of leaky gut. One of the hidden causes of leaky gut, these days, most people know about leaky gut. That's when the intestine becomes permeable and toxicity enters into the bloodstream. There's always going to be a leaky gut component to chronic disease states, long COVID or long or chronic Lyme disease, diseases that don't heal, where they just degenerate, where the condition just gets worse and worse, are usually, almost always actually, I would say, associated with toxicity that enters into the bloodstream through a leaky gut. As it turns out, I got to sneeze here. Hang on a second. Excuse me. Estrogen is inflammatory, and it can cause, excuse me. Estrogen is inflammatory, and it can be a cause or it can exacerbate leaky gut. As it turns out, progesterone, which antagonizes estrogen and is non-toxic and available over the counter, will decrease gut permeability. This is from the journal Nature. Progesterone has been shown to inhibit inflammation in the gut. Excuse me. Sorry about that. Progesterone has been shown to inhibit inflammation, also systemic inflammation, and also inflammation at the level of the intestine. In autoimmune diseases like SLE, patients were found to have reduced levels of progesterone. In addition, progesterone also inhibits certain cells that are involved with the development of systemic lupus. This was the autoimmune disease that was examined, but you can assume that other autoimmune diseases are going to, you get benefits for other autoimmune diseases with progesterone. And interestingly, according to this article in Nature, vitamin D was also shown to work synchronous and to synergize with progesterone. The relationship between vitamin D and progesterone, and vitamin D is also a version, like progesterone, is also a version of cholesterol, or a type of cholesterol. You know that? Vitamin D is a type of cholesterol. It's actually derived from cholesterol. I consider it to be a type of cholesterol. And then finally, according to this article, other studies have shown, quote, maternal obesity is a risk factor for low progesterone levels, particularly during pregnancy. Next slide.
And before we move on, Ben, Patty says, this is great. And also she says, bless you.
Oh, thank you. Thank you. I appreciate that.
Okay, continue.
All right. This next article here is from, is this the one? Okay, this is from the journal I don't even see what the name of this journal is here. Oh, the JABRA Assistance in Reproductive Biology, Effective Progesterone Administration on Mast Cells. Mast cells are cells that produce histamine. They're located in the blood, and they're located throughout the connective tissue, and they're especially located in the intestine. They're the real cause of this, of the elevated histamine, not the cause, but this is where histamine is derived from, the mast cells, and instability in the mast cells following ingestion of food, the release of histamine in blood, negative health challenges, duct health challenges, menstrual problems, tender breasts, cancer associated with elevated levels of histamine.
All right, looks like we've lost Ben for just a moment. I'm sure he'll be back with us shortly. And what Ben is doing is profound, because he's not just citing one source. He's what he's sort of showing us in these podcasts is that there's a that what he proposes within looking at health and disease through the triangle of disease, very simply the gut, the adrenal complex, and blood sugar, by concentrating on the balance between those three systems. Okay, Ben is back.
Oh, okay.
All right, Ben. All right.
Was I gone or were you gone?
You had the aliens had captured your voice and your audio.
I thought you were gone, but I was gone. All right. So the next article from Neuroscience Research: ovarian progesterone suppresses depression and anxiety. This is interesting, by increasing lactobacillus, which is a type of gut bacteria. In other words, progesterone supports gut bacteria, and the net effect is a suppression of anxiety and depression. Estrogen has the opposite effect. Estrogen is a depressant and also can induce anxiety, as many women may recognize. It turns out that ovarian progesterone has a beneficial effect on gut bacteria, and via this beneficial effect, suppresses depression and anxiety symptoms. Let's see here from the journal Neuroscience Research: ovarian progesterone suppresses depression and anxiety-like behaviors. Progesterone treatment changes the gut microbiome. Progesterone promotes the growth of Lactobacillus reuteri, which is a type of gut bacteria, and Lactobacillus reuteri actually reduces depressant behavior. Finally, progesterone itself can reduce depression and anxiety by increasing these gut bacteria. Next slide. From the journal Drug Discovery today, disease models, the central role of ovulatory disturbances in PCOS. PCOS is a really hideous condition. I've been dealing with PCOS as part of my skincare business for now 25 or 30 years. Polycystic ovarian syndrome involves elevated insulin levels, dysglycemia, messed up blood sugar, and probably most importantly, elevated levels of estrogen. No surprise, because of progesterone's balancing effect on estrogen. It turns out that progesterone therapy can be beneficial for women dealing with PCOS. PCOS causes a whole slew of health challenges, including reproductive problems, infertility issues, dysmenorrhea, problems with the menstrual cycle, breast tenderness, cysts, and polyps, and fibroids. Polycystic ovarian syndrome literally means lots of cysts in the ovaries, and then really hideous obesity, weight gain, and really hideous skin problems, including oily skin, very acne-prone skin, even boils and cystic acne can occur from polycystic ovarian syndrome, and possibly most troubling for women, hirsutism, which is body hair and facial hair, mustaches, and also alopecia, hair loss. You can see polycystic ovarian syndrome is a really, really big problem. It's caused by elevated estrogen in addition to elevated insulin and dysglycemia. Using progesterone can have beneficial effects on estrogen, excess estrogen, by balancing it out. And also, as it turns out, progesterone can help stabilize blood sugar as well, or can help lower blood sugar. So that's another benefit for progesterone. Actually, I wouldn't say lower blood sugar, I'd say stabilize blood sugar levels. And also insulin. Next slide. And then progesterone therapy increases thyroid levels. Thyroxine is thyroid hormone. I should say thyroid hormone levels. This is from the Journal of Clinical Endocrinology. What do we have here? Progesterone caused a significant free T4, that's a type of thyroid hormone, increase that was discovered during this randomized controlled study. The clinical importance of T4 remains to be documented. T4 is pre-thyroid hormone, or some people say weak thyroid hormone. It itself has to get converted into T3, which is strong thyroid hormone. And in order for that to happen, you have to have healthy digestive functioning, healthy intestinal functioning. Probiotics and good bacteria are involved in the conversion of T4 into T3, or weak thyroid hormone into strong thyroid hormone. So these guys, the publishers or the authors of the study, say that the clinical importance of T4 remains to be found. Nonetheless, upregulating or increasing the production of T4, you can assume it's going to have a beneficial effect for hypothyroid patients. Yet another wonderful benefit of progesterone. And finally, next slide, Liam, we come to using progesterone for men. Progesterone is not just for women. Progesterone has benefits for men as well. Remember, progesterone is a calming hormone, and these calming effects transcend gender. So women will get a better sleep, relaxation, anti-anxiety, antidepressant benefits from progesterone. So will men. In addition, prostate cancer is associated with elevated estrogen, because progesterone balances out estrogen. Men who are worried about prostate disease or prostate cancer or BPH may find benefits from progesterone supplementation. Progesterone influences sperm production, has a beneficial effect on sperm production. It improves sleep. It has beneficial effects on tumors, specifically tumors of the central nervous system, as well as beneficial effects for the immune system, the cardiovascular system, the kidney system, fat tissue, as well as the respiratory system. And these are all from an article that was published in the Journal of the Aging Male from 2004. Progesterone, the forgotten hormone in men. So one of the things, next slide, Liam, one of the things about progesterone is medical folks are oftentimes confused about the distinction between progestins and progesterone. And oftentimes, if a medical professional understands the importance of progesterone, what they'll do is they'll recommend a progestin. Can you pull that slide up a little bit? The problem with the progestins is, number one, they all require prescriptions. A little bit higher. Keep going a little bit higher. A little bit higher, higher, higher. Till those circles. Till you see those circles. There you go. Right there. There you go. Right there. The progestins, number one, require prescription. But number two, they're super, super, super toxic. Remember, one of the beautiful things about progesterone is it's non-toxic. It's gentle. This is why it's available over the counter. Progestins are the pharmaceutical version of progesterone. They're the drug version of the non-toxic over-the-counter progesterone, which comes as a couple of these, Prometrium and Crinone, are prescription progesterone, but you can get progesterone over the counter, which I'll talk about here in a moment. Progestins have different names. Norethindrone, you'll see that on birth control pills a lot. Medroxyprogesterone is another example of a progestin, and medroxyprogesterone, also known as Provera, has a reputation for being really, really toxic. In fact, all of these progestins are extremely toxic. Most of the ones on this chart are found in birth control pills, and they're super, not only are they toxic, not only is the molecule toxic, that's why it's a drug, but they are used in very high concentrations. And so a lot of times medical professionals will say, oh yeah, we know about progesterone. What they really mean is progestin. So if you're a patient and you go to a medical professional and he tells you he's going to put you on progesterone, make sure it's real progesterone, whether it's the prescription version, Prometrium or Crinone, or whether it's the over-the-counter version. Personally, I prefer the over-the-counter version, and I'll tell you why. Next slide. It's because with the over-the-counter progesterone, most of the over-the-counter versions of progesterone, in fact, I think all of the over-the-counter versions of progesterone are topical. When you apply progesterone topically, you get a slow release of the progesterone into the bloodstream. You get a sustained release over time when you use it topically. When you take an oral progesterone, the progesterone levels go up and then they go down. You spike and then go down, rather as opposed to the topical progesterone, which goes in very, very gradually, and you get a sort of slow release of that progesterone. The second reason why I like topical progesterone versus oral progesterone, or even or oral progestins is because topical progesterone will give you skin benefits. So when you use your progesterone topically, not only are you going to get the sustained release of systemic progesterone into the bloodstream, but you also get skin health benefits. And in my pharmacy, I actually make a wonderful progesterone serum that is designed for topical use that will deliver progesterone systemically. So it'll help relieve your hot flashes and your night sweats and your anxiety. And for men, it's great for sleep. For men and women, it's great for sleep and for relaxation. It has all the wonderful benefits of progesterone. Plus, you get skin benefits. It's skin softening and it's anti-aging. And in my progesterone serum, you also get vitamins. So that always is a benefit. And my topical progesterone is only made with 5 ingredients. 3 different vitamins: progesterone, vitamins A, D, and E, progesterone, and a transdermal ester that's derived from argan oil that allows that progesterone to get into the bloodstream through the skin. When you use it, you get skin health benefits, anti-aging benefits, skin lightening benefits, skin softening benefits, and you get benefits, systemic benefits, all the wonderful relaxation benefits and anti-aging benefits that you get, anti-estrogen benefits, I should say, that you get from systemic or progesterone, delivering progesterone into the bloodstream, into the system in general. So don't sleep on progesterone, if I could put it that way. Don't underestimate the importance of progesterone, especially if you're menopausal or if you are suffering from a health challenge like PCOS or autoimmune disease, depression, anxiety, elevated estrogen. You're worried about exposure to what are called xenoestrogens, foreign estrogens. Progesterone will balance out all of those untoward effects of estrogen. Plus, it will actually increase the cell's receptivity to estrogen. So you'll actually get some estrogen benefits as well when you use progesterone. It's available over the counter. It's non-toxic. What more can you ask? Also, remember, vitamin D will synergize your progesterone, synergize with your progesterone. So if you're getting out in the sun, you'll be upping your vitamin D levels. You could also, of course, use supplemental vitamin D or get vitamin D from foods. The sun is going to be your best source of vitamin D, and that will have synergistic benefits with your progesterone. So you get even better progesterone effects if you're out in the sun and you're upregulating your vitamin D, even if you're supplementing or taking with food. Love, love, love progesterone. And on another video, I don't know about next time, but one of these videos real soon, we'll talk about pregnenolone, which is a precursor to progesterone, has many of the same hormonal benefits as progesterone. It's also available over the counter, and it is also non-toxic.
Bravo. Man, I had no idea progestins were
Progesterone.
synthetic progesterone.
You didn't know about the distinction?
I didn't know the distinction. And you're saying that this progestin is an industrial, like
Industrial is a good way of putting it. It's pharmaceutical and pharmacological and toxic. Progesterone, gentle.
An engineered oil molecule is progestin.
Yeah, drug companies like to tweak molecules so they can patent them. Progesterone is not patentable.
That's why.
You tweak it a little bit, and all of a sudden you get a patent, and you can sell it for a whole bunch of money. And because physicians sometimes don't know the difference between the two, they'll just recommend the progestins as if they were progesterone. They're not. That's why progesterone is available over the counter, and progestins require a prescription. Don't be fooled by the progestins. You want the real stuff. The smarter medical professionals and dispensers will dispense real progesterone, but oftentimes they'll do the drug version of progesterone, which is like prometrium is what they call it, and it's still gentle. It's not like a progestin, but you don't need a prescription for progesterone. Why mess around with the prescription stuff? You can get the over-the-counter stuff. You can just get it right off of Amazon. And the transdermal progesterone, as I said, gives you that sustained, slow release rather than the oral progesterone, which spikes your progesterone levels, and then your progesterone levels drop.
And then where could people go if they want to buy this cream? And can you give us another, once again, run down the cream that you're selling, yes, the progesterone, with the vitamin A, all this cool other stuff that was...
Yeah, vitamin A, D, and E all support progesterone, particularly vitamin D. And I put those in my Pro Harmony progesterone serum. You can shoot me an email if you're interested in it, at fuchs.ben@gmail.com or ben@ksco.com. and we'll sell it to you. Or you can get progesterone if you don't want the good stuff, which is the stuff I make. If you're satisfied with just any progesterone cream, you can find it on Amazon, or you can find it on many health food stores will say, not all of them. Some of the health food stores don't like to carry it, but a lot of health food stores will. One other thing I should tell you is sometimes wild yam cream gets portrayed as a progesterone cream. It's not. You got to make sure that your cream or your serum or whatever you're buying topically over the counter actually says contains real progesterone or is made with real progesterone. Don't be fooled by wild yam, which has precursors to progesterone. So sometimes, unfortunately, there are companies who will play loose and fast with the facts and sell wild yam cream, which contains precursors to progesterone, as if it were a progesterone product. You got to make sure that it says contains real progesterone. Most of the time, you'll find 2% progesterone. My Pro Harmony is 3% progesterone, which gives you a little bit more progesterone. Either way, you want to make sure it says contains real progesterone, not wild yam. Sometimes you'll see progesterone derived from wild yam. That's good, but you want to make sure it says progesterone, not just wild yam.
And what I like so much about this idea of the cream is that it bypasses the digestive system, so you don't have to worry about what you're eating or to conflict with, and also, the fact that it goes in slowly.
And also, I forgot to mention, now that you brought it up, is when you take an oral progesterone, it gets filtered by the liver. It gets processed by the liver. When you put it on your skin, you bypass all that. It goes right into the bloodstream. So you'll actually get more progesterone benefits, and you'll need a lower dose if you use it topically, because you're not going to have to worry about what they call first pass effect, which is the liver's processing of that progesterone. So if you take it orally, your liver's going to kind of filter it through, break it down. And by the time you get a little progesterone into your bloodstream, most of it's already gotten transformed by the liver. That means that the dose of progesterone you're taking orally has to be higher. When you put it right on your skin, you bypass the liver, so you don't need as much of a dose to get the same kind of progesterone benefits. And plus, you get the whole you don't have to worry about that spike and that drop that you get when you take any kind of oral medication or oral substance. And that's why I like the transdermal progesterone, which is handled really well by the skin. Topical steroids in general are handled very well topically by the skin.
And says, great information. Thank you, awesome. Valerie.
Thank you, Valerie,
much for your comment. Patty, we love you. Thank you so much for your contribution, and thanks everybody for watching.
Thank you, Liam. Thank you, everybody.
Outstanding podcast. All right, so we will see everybody again next week. Have a great rest of your day.
Bye.
Thanks a lot.